Hepatocellular carcinoma is the fourth leading cause of cancer-related deaths worldwide. Little is known about their immune response and its relationship with HCC. However, the majority of drugs under clinical trials are immunomodulators. Therefore, it is important to establish an understanding of the HCC immune response. The immune system plays a pivotal role in determining tumor control versus progression. In this article, we discuss the role of the innate and adaptive immune system in shaping the body's response to HCC. Several important differences exist. For example, the innate response acts almost immediately, but with limited specificity. In contrast, the adaptive immune response is more gradual in onset, but more sophisticated. The two involve entirely different cell subtypes. From our research, it appears that striking a balance between immunotolerance and a robust immune response to HCC tumors may be optimal. The liver at baseline is fairly immunotolerant, but there are other pro-tumor factors that promote tumor progression, such as regulatory T and B lymphocytes. Factors that limit HCC growth include cells capable of exerting direct cytotoxicity, for example, natural killer or NK cells. Although normal hepatocytes have the ability to self-repair and regenerate, repeated insults can cause irreparable damage. Tumor progression is ultimately driven by the inflammatory and hypoxic environment that favors fibrosis and angiogenesis. Some of the key cell types involved in modulating the tumor microenvironment are shown in the slide. Excessive immune tolerance enables tumor progression. However, an amplified inflammatory response may actually be counterproductive. Cancer-associated fibroblasts and hepatic stellate cells appear to be of special importance in promoting tumor progression, for instance, by physically limiting lymphocyte infiltration. Current approaches to treating HCC with immunotherapy amplify the body's natural anti-tumor immune response or block mechanisms of immune evasion by tumor cells. The three strategies under current investigation include adoptive cell transfer, cancer vaccines, and immune checkpoint inhibitors. In adoptive cell therapy, selective immune cells are removed from the patient, modified, and then reinfused. The goal of therapy is to amplify tumor control mechanisms. CAR T cells, chimeric antigen receptor T cells, represent one of the most promising areas of this research. Cancer vaccines are designed to amplify the body's natural immune response against tumor cells in a similar fashion. Checkpoint inhibitors have been used in other cancers such as Hodgkin lymphoma and melanoma. The main immune checkpoint targets for HCC are CTLA4, PD-1, and PD-L1. These targets are expressed by regulatory T cells to downregulate the immune response. HCC exploits this natural host mechanism in order to evade surveillance. Examples are shown on this slide. Currently, nivolumab, for example, is the only anti-PD-1 antibody that is FDA approved for the treatment of HCC. It is clear that the immune response to HCC is complex. Interestingly, when it comes to the immune response against HCC, it appears that less is more. We hypothesize that excessive immune reaction against tumor cells activate pro-inflammatory cycles of wound healing and fibrosis that may ultimately be maladaptive. In conclusion, a better understanding of the immune response to HCC is necessary and would enable a better diagnosis, tumor characterization, and ultimately treatment of this disease.